Hi, I'm Dr. Claire Minchell, founder of Get Back to Sport, and in this video we're going to be looking at the collateral ligaments of the knee. There are two collateral ligaments in the knee. If we look at this knee joint model here, we have one on the outside called the lateral collateral ligament, which you can see there, that goes from that part of the femur through to the fibula. And then we have one on the medial side, on the inside of the knee, which is much bigger, which comes from this part of the femur here through down onto the tibia. The roles of the collateral ligaments in the knee are to maintain its stability in conjunction with the PCL, the posterior cruciate ligament, and the anterior cruciate ligament, which is the ACL. So the lateral collateral ligament, which is the one on the outside here, that resists stresses and strains in that direction. So where the knee is opening up laterally, and that's called a varus stress. The ligament on the inside of the knee, there, so the medial collateral ligament here, that resists stresses and strains in the opposite direction, which is that way. If I tilt it down, you can see. Okay, and that's called a valgus stress. So knee varus and knee valgus stresses. How do you injure your collateral ligaments? Well, in the case of the medial collateral ligament, so that's the big ligament down on the inside of the knee, the mechanisms can be twofold. One is a direct blow to the outside of the knee, which causes the joint to open up like that. Another way in which the medial collateral ligament can be injured is during sports such as football or soccer, whereby you're sprinting, suddenly stop and change direction, so there's a rotational stress and also that valgus stress on the knee joint. Often in really big injuries, there's the chance that the ACL, so the anterior cruciate ligament, and the medial collateral ligament, so the MCL, can be injured concurrently. So that's the ligament on the outside here. Can be injured by a similar mechanism for the MCL, so that's a direct blow to the opposite side of the knee, meaning that the joint opens up like that. Indeed, as well, perhaps a twisting injury can cause that to happen, again with considerable forces going through those ligaments. They can be classified further into first, second or third degree. So the first would be where only a few fibres are damaged. A second degree would be where considerably more fibres are damaged. And a third degree would be where there's a complete rupture of that ligament. If you're a personal trainer or fitness professional and you've got clients with injury or have had in the past, then we run a range of courses specifically for you to help manage that injury and be effective in training the injured client.